And welcome back to Inside Olympia. Since the start of the COVID-19 pandemic, minority Republicans have been critical of many of the decisions made by Governor Jay Inslee. And now, as the pandemic emergency stretches beyond a year and a half, Republicans have renewed their calls for a special session of the legislature and for changes to the governor's emergency powers. Joining me now to discuss this and other issues is House Republican Leader J.T. Wilcox. Welcome back to the program, and good to see you.
Thanks so much for having me, Ross. It's always a pleasure.
So before we talk COVID and emergency powers, I do want to ask you about the news of the week, which was these redistricting maps that came out from the 4 commissioners. Of course, they now have to agree on a final set of maps, but what are your top line reactions to what you've seen so far?
Well, I think the situation always imposes its own logic on the commissioners. And if you represent a majority party, you want to lock in that majority. And I think that's exactly what the Democratic commissioners did. If you are part of the minority party, you want to create as much political competition as possible. It doesn't mean you're going to win it always, or maybe even ever, but you believe that the voters should have a choice. It should not just be a choice of blue or bluer. And, you think that in wave elections, or as the political climate of our state changes, we can go back to being a 2-party state. And I think that's best for everybody.
One of the things that Speaker Jenkins said is a priority for her is to really be mindful of communities of interest, to try to not divide up those communities. And she mentioned tribal communities. She mentioned communities, even cities, groups of small cities, and of course, diverse racially and ethnic diverse communities. Was there an organizing principle for your caucus going into this, or something in particular you want to get out of this besides more competitive, a greater number of competitive districts?
Well, first, let me say that what you just described is some pretty broad strokes. I stay very close to Washington State's tribes. Most of them are represented by areas that have elected Republicans. And it's true that most of them said that they would like to stay within one legislative district, but there were several that then differentiated themselves and felt pretty comfortable being part of more than one. And so, like we listen to all communities, we listen to those, and I believe that the House Republican map recognized the diversity that you have in opinion among tribes. When it comes to communities, whether they are geographical or racial or minority, I think it is important to look at those. In the past, there have been major efforts to create majority minority districts. When people talk about that, they often think that that only means in Republican areas, but I think it's absolutely true that those things happen in areas that usually vote Democratic as well.
What is your thinking about this commission's ability, given how different these maps are and the different competing priorities, to get to a final set of maps where they can get a majority vote and some agreement?
Well, these are starting positions, and I've talked to a lot of people that are very uncomfortable with these starting positions. Not one of these maps is going to be the map that is settled upon. It's a high stakes negotiation, but the people that have been appointed to be commissioners are used to negotiations. And it's also one that there's a penalty for walking away from, and that is that it just all goes to the Supreme Court, and no one really knows what happens from there. And so I think that there's going to be convergence, and we've done this a few times now. People may forget this was all created by a citizens initiative quite a few years ago, and we've been successful up till now. And the other thing that really happens is there is no cataclysmic change as a result of redistricting. It happens over time. And, I think in the end, you create these communities to some extent around the boundaries of the legislative districts, because they create a sense of community as well.
Just longer term, one of the things we saw with the census data, and part of what's having to inform the drawing of the districts, is you're trying to keep roughly the same number of people in each legislative district. So that, by necessity, will mean that some currently very blue districts in central Puget Sound will shrink because they have too many people, and conversely, some very Republican districts, especially in more rural parts of the state, will have to get bigger. How are you responding to and thinking about politically the changing kind of population, the geographic basis for our population in this state, and how that and what the implications are for, in particular, Republicans in red districts?
Well, I think you've heard me say before, I think it's very unhealthy that we've ended up with not only this political divide, but this, it's kind of a geographical divide where you have the largest cities being deep, deep blue and everybody else being some shade of red. And we should not really be sorting ourselves out in that way. I think it means that, especially when it comes to the legislature, people just don't understand each other. And you lose the sense that we should be legislating for what's good clear across the state. And if we can't create a solution that's great for the whole state, then we should create a solution that allows people to live in different places to choose for themselves. And so I will always push back on the idea that geography is going to be destiny forever. And I believe that Republicans should get way better at representing people that are more urban, and Democrats should get way better at representing people that are less urban. My district, second district, is one that has traditionally been one of the geographically larger districts in the state. In the last two redistrictings, it has had to shed some population because it is a relatively high growth area. I don't really like saying shrink. One of the challenges that we have is you look at the map and it seems like acres vote, and of course we know that they don't. This is a government that is supposed to be by the people and for the people, not the acres. So when you look at a map, you can get very confused about why these shapes appear the way that they do, and often it's not because there's ill intent. It's because it's all about getting the right number of people in the district rather than making them all look square or consistent in some way. The fundamental thing that I think people have not got their heads around at this point is there has been more growth in Western Washington, and as it was explained to me in a conversation with Paul Graves, the House Republican negotiator. Let me go back. Everyone knows that there's more growth in Puget County. It's what it does to the map making that it's confusing. And Paul tells me the biggest challenge that he has is that there's about 50,000 people that live in Western Washington that need to be incorporated into one of these districts that has been largely Eastern Washington. So there's not that many ways to do that in terms of creating a district that representatives can even travel to. You can't do it over the North Cascades because there's just no connection. So you're really left with two solutions. You have to come over Snoqualmie Pass with District 13. That's the choice that the two Republican commissioners did, or you come through Clark County. Which is the choice that the two Democrats made. They all have their differences for those things, but unless you are willing to accommodate those big changes, you can't really draw any districts in isolation. And you have a similar problem up and down the Washington State coast. The 19th and the 24th need to have more people in them. That's a lot of empty ground in a lot of cases, and so that means that they kind of intrude into the Western Puget Sound area and make it harder to draw those districts.
Yeah, you can't go west from where they are, can you?
Well, Hawaii wouldn't be happy about that.
Okay, let's skip ahead here and look to 2022, and before we look back a little bit or get back to the present tense, what are you expecting and hoping for in terms of the 2022 legislative session operationally, given COVID? It was obviously a mostly remote session this year, and a lot was learned about how that works, and there was clearly more public participation, at least in terms of committee testimony. But we also know the Capitol building was closed for security and COVID reasons, and that for the most part, you all weren't meeting in person. So what do you think is possible? What do you think is realistic? What kind of conversations are you having with the speaker?
Well, actually, I am putting together a House Republican group to create our own proposal for how we can craft this with the maximum amount of quality public participation and still be safe. And the House Republican lead on that is Joe Schmick, who's the ranking member on healthcare. So we're taking a health perspective on this, but at the same time, I emphasize the word quality. I think one thing that we saw this year is that when you have 30, 60, 90-second limits to testimony, you have a lot of testimony, you have a lot of people on, but it also sometimes drowns out the voices of the people that are most severely affected by the legislation. People don't understand sometimes that most bills impact a narrow group of people, and you know, they're passed for the whole state, but the whole state doesn't bear the burden of the mandates or the mistakes that are made in the legislation. And good legislation, I think, means that you really listen to the people that are most affected by the bills that you pass. And I would submit that there were a number of bills that were passed in a hasty way this last session, and have resulted in immense public cost and resentment. The three or four that I would mention are the, you know, first, the public safety bills that are poorly understood, suffered from lack of input by the people that would have to implement those, and are widely recognized even by the people that sponsor the bill as needing a lot of correction. Clearly, the process created poor legislation in that case. And then the other one that I think is becoming more and more apparent to people across the state, and this one affects almost everybody, is the long-term care tax that is a payroll tax on everybody that you know, is employed. It is not very useful for many people. Anyone that moves out of state will lose the benefit after having paid into it potentially for decades. And there was not really sufficient, you know, I think, public view on the implications of that bill. And so I would like to see something that has more face-to-face contact, a way of doing business, even though we are trying to be safe, and especially one that that doesn't allow legislators to really dodge the kinds of input that are absolutely necessary. I recognize the fact that there are some people that have special health conditions or just don't want to expose themselves, but I also think those that want to come to Olympia, do their jobs in a safe way, and engage to the maximum extent possible with the public should be able to do that.
Just a point of clarification that the long-term care bill, the foundational bill for that program, passed a couple of years ago. I think there was a follow-up bill this year, and I do want to ask you more about that program in a moment. What would you say to a vaccine mandate for members and staff of the legislative branch in order to come back and be in person?
Well, I think the truth is the people that work in the legislature should not have special privileges one way or the other. I think, you know, I'm a super strong supporter of vaccinations. Everyone in my family is vaccinated. I've had COVID before vaccination. Some members of my family have had some breakthrough cases. So safety is really important. Dealing with people equally is also important. But I also think that one of the barriers to vaccination has been to make this, impose this in such a big brother fashion. And I'm not really in favor of compelling people to have something put in their arm.
So if not that, to come back in session, what would you offer a mandatory testing alternative for those who aren't vaccinated? And I realize you're just putting this work group together to look at what might work and what this might look like, but yeah, what do you think?
I don't want to pre-commit that group, and I think an awful lot of Joe Schmick's judgment, and I think the other side thinks a lot of his judgment as well. But I think two other issues that in the long run it should be part of the equation, I think, across the country too, is testing. Because again, there are people who very legitimately have been advised not to subject themselves to that risk. And also antibody testing At this point, the CDC hasn't issued guidance. That's tragic. I think doing that would increase credibility of all of our efforts, but recognizing that there's more than one route to being less at risk. I was going to say being immune, but we have now found through breakthrough infections that, you know, the severity of the disease might be more important in some cases than whether or not you're going to get it.
Yeah. Speaker Jenkins, works in public health, said repeatedly during the interview that vaccines are our ticket out of this. The governor has said that. You clearly support the idea of people getting vaccinated. We've seen hospitals overrun again. We've seen a spike in cases like in the last month or so, unlike anything we've seen during this entire pandemic. And frustration levels are rising on the part of people who are vaccinated, who are saying, if others would just get vaccinated, maybe we could really curb this. Maybe not make it go away, but curb it, get a handle on it. And that may be what's motivating the governor, who's now ordered large swaths of the workforce to get vaccinated. Why is he wrong to order state employees and healthcare workers and long-term care workers and educators to get vaccinated in light of the current situation we're in and how dire it is, and the fact that this is a pathway to getting a handle on it?
Yeah, again, I'm so in favor of vaccination. I hesitated not at all. And you and I have joked about the fact that I've given tens of thousands of vaccinations myself. So I
to chickens, not to livestock, right? Not to
absolutely. Yeah, never once to a human being. But I think we all have to own the result. And I think that there's an amazing amount of vaccine hesitancy or resistance now that is due to people feeling like this is my body, this is my health, and I don't think I should lose control over that. And even if I disagree with that, I want those people to decide on their own to get vaccinated. And I think more would get vaccinated if we had a less draconian approach to this. We're creating resistance by the methodology. And so if you care about the results more than the means, I think, you will continue to recognize that people have a natural desire to exert control over their own health and, continue to send the message that this is important. And I've done public service announcements promoting this idea. But you have a lot of people that I think are shocked that they can be required to do this, and in other circumstances might willingly take the vaccine.
How do you reconcile, though, what's happening in states like Idaho, where they aren't imposing these kinds of mandates, and things really are on fire? I mean, makes what's happening here pale by comparison, and what's happening here is very serious.
Well, and there's other examples like Nebraska where they have avoided mandates, and I believe that they are like the sixth lowest death rate and infection rate. So we clearly don't have the magic bullet here, the silver bullet. We didn't win the Super Bowl, and we've been wrong so many times along the way. And I think by being so convinced that we know everything, we've damaged our credibility at every step.
So this idea of coming into special session to address the police reform bills, to do those quote unquote fixes now rather than in January, and also to address the emergency powers, you and Senator Braun, who was on the program last week, called for a special session after the governor issued his vaccine mandate. When I asked Speaker Jenkins about this, she said, again, we don't need a special session. We need people to get vaccinated. And regarding the police reform bills, my sense from majority Democrats is that they think they are working on these trailer bills and that they think they can wait till January. So why do you feel so strongly that the legislature should come back now?
Well, first of all, it's a tragedy that they didn't listen in the beginning when it came to the objections of the people that would have to implement the public safety bills. And I don't think it's a process that's important, and listening that's important. You can do that pretty quickly if you're very committed to that. And why do we want to subject the people of Washington to a less than ideal public safety set of rules if we can fix them easily. And as far as whether or not we should have a special session, I believe the Democratic Senate budget lead, Senator Christine Rolfes, recently was quoted as saying that we should come in quickly in a special session and fix the long-term health care tax. I think she said that she's not had one call telling her it was a great idea, and her office has been overrun by calls telling her that it's a bad idea.
Well, on that note, well, let me just ask you a little bit about the emergency powers. At this point, if you came back into special session to address emergency powers, and again, there's no indication this is going to happen, but what is the change that you would make? And I understand that most people think of an emergency as a shorter term event. Maybe the Emergency Powers Act didn't contemplate a pandemic, but the reality is this emergency is stretching on for longer than 30 days, 60 days, or 90 days. How would you rein in the governor? Or why would you rein in the governor at this point?
Let me go back to something that I said before. I think we would have better results if more people felt like they were part of the process, and if you had more public discussion and debate. People could see a debate about whether or not naturally acquired immunity is going to be, part of our criteria, for example. And they'd hear the reasons for that and the reasons against that. And one of the ways that I think we could increase credibility and the sense that we have the consent of the governed would be to say, okay, Governor, we understand that whoever's the governor needs to have emergency powers, because emergencies happen and they don't always happen in a way that we could have anticipated. But let's just look at this every 60 days and have a simple majority vote. Does the emergency continue or not? This is a one-party state right now, and mostly has been for the last generation. So a Democratic governor has nothing to fear from a Democratic legislature. But if you did that, I think you would have a debate and people would see their concerns aired by the majority party or the minority party. And at least you'd have some of these questions answered, and then the governor could go about his business. But I think every time he took a step, he would also be thinking about, okay, is this going to be approved by a majority in the legislature?
On the police reform bills, is there a specific change that you think needs to be made to one or more of the bills now that can't wait for January?
Well, you're probably going to catch me in forgetting one or two of these things, but they're
and just an example is we're short on time anyway. So is there one example of what you think can't wait till January?
Sure. Well, the quickest one is there was a restriction on caliber of weapons that meant that these non-lethal beanbag rounds could not be used anymore. So that is one of the really quick fixes that can be done. Another is just make it very plain: police can assist with mental health crisis. Then there's one other that's a priority, but it's not in my head right now.
That's fine. On the long-term care program, which I said we would get back to, the tax kicks in January. Are you, and I asked the speaker about this, I mean, do you think that the program should be paused, tossed out? The Democrats are talking about, and I think there's a bipartisan commission that's looking at, changes and tweaks that could be made to make it more portable, for instance. But what's just to help us understand your position on this program, which was put into state statute a couple of years ago, but now is about to kick in?
I think it's going to be really difficult to fix this. It's not self-sustaining. It is. I'm a Republican. I'm pretty anti-tax. This is already a payroll tax on everybody that gets paid through payroll. It's 0.6. It's becoming very plain that that's not enough. I don't think that there's a way to fix this.
Is there any obligation the state has to create a safety net, though, for aging Washingtonians, given that the vast majority don't have access to long-term care, and most will need some long-term care?
Well, this isn't the state creating a safety net. This is a state collecting money from people that is supposed to go back to them, but in many cases won't. It seems like a a pretty leaky safety net to me. I think that there are a number of things that we can do that would address the affordability of healthcare. However, over the last 10 years, we've mostly done things that make healthcare an awful lot more expensive, and hence you see a crisis.
I asked the speaker about polarization, and I was going to end with that with you, but you spoke to it and kind of the role that you think the legislature should play. So I'm going to instead ask you another policy question in the minute we have left, and that is, what about extending once again the eviction moratorium, which is something that is now being called for in part of some advocates?
Yeah, I've said for a long time that I think that the longer you extend this moratorium, the harder it's going to be to unwind. And unless you're prepared to accept the thought that maybe all this housing should just be seized from the owners and given to somebody else, you have to unwind this at some point. There's probably no good point. I think the most important fix that we could apply ourselves to is the fact that there's millions and millions and millions of dollars out there that was designed to be used as rental assistance. And the organizations that have been put in charge of this have been so slow to disperse it that they have created an even bigger crisis, because people could have these rental assistance dollars to pay their rent and not have a problem. But because of bureaucracy, over the course of 18 months, we should be able to solve this, Austin. It shouldn't take 18 months to figure out how do you help people pay their rent.
Okay, on that note, I'm going to stop you there. House Republican Leader J.T. Wilcox, we appreciate you joining us. Thanks for being here. Look forward to the next conversation. And thank you for watching Inside Olympia. We will see you again next week. Thanks for watching.